CVS and Aetna, for our global audience, is a ginormous deal involving something on the order of $250 billion of revenue per year. Our Aaron Kirchfeld has seen this before. He's with our global executive editor for our global mergers and acquisitions team. And Davide Sera, of course, with Algebris, is a little bit familiar with this. Aaron, this thing stinks, and the reason it stinks is price. What constraints can be put in so that this juggernaut, combined with United Healthcare, won't rig the system and rig price across many health industries?
Well, I think you're asking the key question, which is antitrust. I think normally we'd look at this deal and there's this debate about a vertical and horizontal merger here. And in the past, people would have said you can get this through because they're two different companies. But like you said, the government, as we've seen with AT&T and Time Warner, might take a different view and ask, is this giving one powerful player just way too much power across, whether it's health insurance, whether it's the drug prices, whether it's Medicare benefits? So I think that's the key question about whether this deal will get through or not.
Okay, ExxonMobil was not vertical. That was decidedly massive Venn diagram, synergistic merger as well. When you look at this, is there an asterisk around our Bloomberg analysis because it's healthcare, because it's medicine, because it's grandma's, pills at the CVS drugstore, et cetera? Is it a different treatment because it's about our doctors and our medicine?
Well, they're obviously going to argue this is great for grandma because it means she can go to the corner store, not only pick up her drugs, she can get her insurance check, she can get her Medicare benefits. So they'll argue it's actually going to give the client a one-stop shop. But as you say, critics will say this is going to give them just way too much power across the value chain, and so it needs to be scrutinized.
But, Aaron, we don't know who will do the scrutiny, right? So we don't know what agency will do it. It will be different if it's the Justice Department or the Federal Trade Commission.
That's exactly right. Are they going to look at this as a healthcare deal or a retail deal? And let's be honest, it's a hybrid. It crosses so many different sectors, so that debate remains to be seen. But I think what is really interesting is the political angle, because just like we've seen with AT&T Time Warner, everyone thought that would be waved through, and now we're seeing a gigantic legal battle between the DOJ and those companies.